back pain. It's something so many of us brush off as just a part of getting older. But what if I told you that not all back pain is harmless? Some types of pain could be a warning sign of something far more serious, like paralysis, loss of bladder control, or even cancer that's spread to the spine. I'm here today because I've seen too many patients ignore these red flags, and I don't want that to happen to you or someone you love. Stick with me for the next 12 minutes, and I'll share 5 dangerous signs of back pain that mean you need to see a doctor immediately. As a doctor here in the U.S., I've spent years helping seniors live healthier, more comfortable lives, and one of the most common complaints I hear is back pain. It's no surprise. Our spines carry us through decades of lifting, bending, and simply living. For many seniors, back pain feels like an old friend who just won't leave. Maybe you've even said it yourself. "Oh, it's just my age catching up with me," or "I must have slept wrong." But here's what worries me. Dismissing back pain can sometimes mean missing a serious condition that needs urgent care. According to the National Institutes of Health, back pain is one of the leading causes of disability among older adults in the U.S. While most cases can be managed with rest or physical therapy, certain symptoms are red flags for dangerous problems like infections, spinal cord damage, or fractures. Today, I'm going to walk you through 5 signs that your back pain is not normal and what you need to do to protect your health. My goal is to empower you with knowledge so you can stay active and enjoy the things that matter most. Sign 1. Back pain with fever, unexplained weight loss, or night sweats. Let's start with a sign that's easy to overlook. Back pain that comes with fever, unexplained weight loss, or night sweats. If you're waking up drenched in sweat, losing pounds without trying, or running a fever alongside your back pain, this could be a sign of a serious underlying issue. These symptoms might point to an infection in your spine, such as osteomyelitis, which is an infection of the bone, or a spinal abscess. They could also be a warning of cancer that has spread to the spine, especially in older adults with a history of prostate, breast, or lung cancer. According to the American Cancer Society, metastatic cancer to the spine is more common than we think, and it often presents with vague symptoms like these. If you're experiencing this combination of symptoms, don't wait. Call your doctor and mention these specific signs. They may order blood tests or imaging, like an MRI, to get to the bottom of it. Sign 2. Severe pain at night that doesn't improve with rest. The second sign is back pain that's worse at night or doesn't get better when you rest. Most back pain from muscle strain or arthritis feels better when you lie down or take it easy. But if your pain keeps you up at night or it's so intense that no position feels comfortable, that's a red flag. This kind of pain could indicate a spinal tumor or inflammation in the spinal cord. For example, conditions like multiple myeloma, a type of cancer that affects the bones, can cause relentless pain that's worse at night. The National Cancer Institute notes that spinal tumors are rare, but more common in older adults. Another possibility is ankylosing spondylitis, a type of inflammatory arthritis that affects the spine. If this sounds like what you're going through, please don't ignore it. Nighttime pain that doesn't respond to rest needs a thorough evaluation, often with imaging like a CT scan or MRI. If you're experiencing this combination of symptoms, don't wait. Call your doctor and mention these specific signs. They may order blood tests or imaging, like an MRI, to get to the bottom of it. Sign 3. Numbness, weakness in both legs, or loss of bladder, bowel control. Now the third sign is one of the most urgent. Back pain combined with numbness or tingling in both legs, weakness in your legs, or loss of control over your bladder or bowels. If you're finding it hard to walk, feeling like your legs are giving out, or having accidents when you didn't before, this is a medical emergency. These symptoms could mean your spinal cord is being compressed, possibly from a herniated disc, a spinal fracture, or a condition called cauda equina syndrome. Cauda equina syndrome is rare but serious. It happens when the nerves at the base of your spine are squeezed, and it can lead to permanent paralysis or loss of bladder function if not treated quickly. The American Association of Neurological Surgeons emphasizes that this often requires surgery within hours, not days, to prevent irreversible damage. Common symptoms include urinary retention, followed by incontinence, saddle anesthesia, numbness in the perineal area, weakness or paralysis in multiple nerve roots affecting the legs, sciatica-like pain, and sexual dysfunction. Time is critical here. Delaying treatment can lead to permanent nerve damage. If you or a loved one has these symptoms, go to the emergency room right now. Don't wait for an appointment. Your health and mobility are worth acting on immediately. Sign 4. Pain radiating from the back down, one or both legs. The fourth sign is back pain that radiates down one or both legs, often with tingling, burning, or muscle weakness. You might feel a sharp, electric shock-like pain that shoots from your lower back to your calf or foot. This is often a sign of sciatica, which happens when a herniated disc or bone spur presses on the sciatic nerve. According to the Mayo Clinic, sciatica typically affects one side of the body and can range from a mild ache to a burning or electric shock sensation. The pain may worsen with coughing, sneezing, or prolonged sitting. While sciatica itself isn't always an emergency, it can become serious if the pain is severe, or you notice progressive weakness in your leg. Untreated nerve compression can lead to permanent nerve damage. In rare cases, this could also point to a more serious issue, like a spinal tumor or infection pressing on the nerve. The Mayo Clinic advises seeing a doctor if self-care measures don't relieve symptoms, if pain lasts longer than a week, or if you experience sudden, severe pain with new bladder or bowel issues. Early intervention can make a big difference. Your doctor might recommend physical therapy, medications, or imaging to pinpoint the cause of the nerve compression. Don't let this pain linger. Getting help early can prevent long-term complications and help you stay active. Sign 5. Back pain after a minor fall or injury. Finally, the fifth sign, back pain that starts after a minor fall or seemingly small injury. For seniors, even a gentle slip or bump can cause a spinal fracture, especially if you have osteoporosis. The National Osteoporosis Foundation estimates that 1 in 2 women and 1 in 4 men over 50 will break a bone due to osteoporosis, and the spine is one of the most common sites. The National Institute on Aging notes that osteoporosis weakens bones, making them fragile and prone to breaking. A minor fall that wouldn't have caused issues in your younger years can now lead to a compression fracture in the spine. These fractures can cause sudden, sharp back pain that worsens with movement or standing. Sometimes the pain might seem mild at first but lingers or intensifies over days. You might also notice a slight change in posture, like a hunch in your back, which could indicate a vertebral fracture. Falls are a leading cause of injury in older adults, and the consequences can be serious, including hospitalization or long-term disability. If you've had a fall, no matter how small, and now have back pain, don't shrug it off. Your doctor may need to order an X-ray or bone density test to check for fractures or underlying bone weakness. Taking steps to prevent falls like removing tripping hazards or using assistive devices, can also protect your spine. Early treatment is key to preventing complications like chronic pain or spinal deformity. Back pain doesn't have to control your life, but ignoring these dangerous signs could lead to serious consequences. Let's recap. If you have back pain with fever or weight loss, severe nighttime pain, numbness or weakness in your legs, radiating pain with muscle weakness, or pain after a fall, please don't wait. These could be signs of infections, tumors, nerve damage, or fractures that need immediate attention. Here's what you can do. Stop relying on painkillers to mask the problem. They might help temporarily, but they won't fix the root cause. See a doctor as soon as possible, especially if you have more than one of these signs. Ask for imaging like an MRI or X-ray if needed. Trust your instincts. You know your body best. If something feels off, get it checked. I'm here to help you stay healthy and active for years to come. If you or someone you love is experiencing any of these symptoms, drop a comment below, and I'll do my best to guide you. Don't forget to subscribe to Zen Senior and hit the bell icon so you never miss a video like this one. Together, we can take charge of your health and keep you moving with confidence. Stay safe, and I'll see you in the next video.